Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Now, this gentleman, whom I've known for a long time, is a superb physician. His name is Dr. MOSHIN Jaffer. And he really has run this, well, he started it. It's the wonderful Senior Medical Associates, and he has excellent physicians there. But I think what I love most about you, Dr. Jaffer, is that you actually have the down-home way of having a practice. You're not like what practices have become, in and out, and that's it. You know everybody. You care about everybody. And did that come from your upbringing?
Yes. Hi, Anita, and your listeners. Happy New Year. You see, in a lot of cultures, as you get older, you get more respect from your family and people around you, and you're part of the society. Unfortunately, here in America, seniors, as they get older, they become more and more lonely, and they have less and less contact with their fellow human beings. And that contact, that social contact, is so important because we are essentially gregarious animals. We need people around us. And I realized that as I practiced geriatric care, one of the biggest things missing in people's lives was that connection, somebody to listen to, somebody to talk to. And that was very important for their health and well-being also. And that's why we created our offices to accommodate that need for patients just to be able to come in and talk to somebody. So the front desk person is trained to just talk and just provide a friendly and an ear for whatever they have to say.
I see.
And that makes a big difference in our patients' lives.
Well, it does. It makes a big difference in everybody's life, even if you're not a senior.
Correct.
But especially seniors, and you're so right. You put it so succinctly and so well that it is very, very important that someone will listen, because older adults have a lot to say. And you know, when you're a doctor especially, you probably find out more about their illnesses than just filling out a form. That's what they give you. Fill out the form, and this way you really discuss it, don't you?
Yes, we don't ask our patients to fill out forms. We make it as easy as possible. We don't have any answering machine on our phones. We have a live person, because seniors don't like that. They like that contact. They don't like machines. They don't like to fill forms, and they like to explain their problem and their needs to somebody live.
Yeah, that is so true. It's very upsetting, as a matter of fact, to hear people. They sit in a chair, and maybe they don't hear so well, and maybe they don't see so well, and just people think they're kind of on their way. They're dying. They're not. They just need someone to care enough and to hold their hand. That's the most important thing. And I know you know this, but people who are listening, the first thing you'll see when you go to a nursing home or someplace, people reach their hand out, don't they? Even if they don't know you.
Yes. They want to touch you. They want that contact. You know what? You just gave me an idea. I think every school, especially from anywhere, elementary to high school in America, we should have our kids wear glasses which have got Vaseline on it so they can't see. So you get an idea how it is to have a cataract. They should put earplugs so they can't hear well, and they should put some marbles in their socks and walk. And spend a few minutes in that state.
Right.
You will be able to understand how it is to be an older person. You can't walk well, you don't hear well, you don't see well, but you still want that contact with people.
Yep.
I think we'll have a little more compassion towards our seniors.
Oh, absolutely. I used to do, and I don't know if I ever did it for your organization, but I did it for quite a few years, and I did it. It was called the sensitivity training. And I used to do that, and it was amazing. When these were big organizations and the doctors sat there, they didn't want to hear anything. They knew everything. They didn't want to hear it. But as I got going, it was amazing how they came up to me after and said, "Gee, Anita, that was really interesting. I never realized."
Yes, it's an eye-opener.
Yeah, it really
You
is.
get much more empathetic towards seniors and their disabilities.
That's true. And the other part about this is, and I'm just going to share something I've heard, and you can maybe tell me more about it. There are people who have gone to hospice, gone into hospice, and with good care, and with lots of good care and caring people, they wind up leaving hospice. And so, what do you think about that? Is that a good sign?
Oh, hospice, I think, is the most underutilized facility in America. It's you see a lot of seniors when they have a cancer or they've got a very debilitating disability are still treated and kept in the hospital and treatment after treatment and chemo after chemo, and they finally die very miserable and really tortured. What hospice does is gives you that relief. But the hospice concept is where you have loving care around you. And that could cure your cancer, could even make you feel a lot better. At least whatever days you have left or months you have left, they are passed with dignity in surrounding where you're surrounded by people who care about you and you're not tortured and at your ease. And you ease into the afterlife.
Yes.
I think that's a very kind gesture to our seniors. I think all of us should really put in our will that our heirs should consider hospice before subjecting our last few months of life to very horrendous and draconian treatment.
Yep, that's well said. Draconian treatment. Oh my goodness. Well, I have to say that I've seen my mother passed away in hospice, but of course I was there with her the whole time, and my father did also. I was just thinking about this. I didn't mean to say that when I was saying it, but and they didn't come back. But there are people who are not. I guess it's called palliative care, that they get in there because they have a lot of pain, and if they're at home, they're just given meds, and they have maybe someone that just is there as a I guess as a helper. But they really do need to be at places where they're going to see life, and they don't want to leave yet. They want to have life, but no one seems to care.
Yes, it's so unfortunate. And also the idea that when you become a little bit frail or something, you're put in a hospital or a nursing home and you never come out. But if you are allowed to live in your own home, to be mobile, to be productive, to feel useful, these people live much better lives. In fact, in many other countries, the government spends a lot of money making sure you stay in your own home.
Yes.
Because nursing homes are more expensive, but
right.
These people also become completely bedridden and they just live a very vegetative life until they die. And they don't die immediately. Some of them live many years in that state. It's such a great torture, and it's pain, and it's for relatives. I think we should all consider hospice and the ability to keep our seniors in their own homes.
Well, also, I guess my question for you as a physician, you're the one, though, that can talk to them because, this is the big problem. Once someone says, whether it's to their loved ones or to them, I'd like to put you in hospice, they said, okay, that's death, I'm dying. What do you say to them?
Yes. The doctors play a very important role. You're so right. It's to show. I tell my patients that the government has been very kind and has given special dispensation to the hospice project. So you can't do custodial care on Medicare. You have to pay for it extra. But in hospice, you get some custodial care, some degree, and you get relief. The relatives can go out of town, can have respite care in the facilities of the hospice company, and they visit your loved one, and they encourage the loved one to be more ambulant, to be more agile compared to just bedridden only. That's a big difference. For seniors, that's a big thing. Even taking a few extra steps every day amounts to a much better health.
Yeah. And so I'm going to ask you, this is, do you have any dogs, by the way? Do you have any pets?
Oh, no.
Okay, but you know enough, I'm sure, your son, and I'm sure enough people you know.
Yes.
So I have a dog who is, I got him from a shelter, and he has congestive heart failure. Now he has some pneumonia. He's being treated, but a nurse told me, because he has this cough, to and I just did it today. I go in your shower, run the hot water, make a lot of steam, and let him get in there, and it should clear him of a lot of things. I did that, and it seems like he's better. Do you believe in that?
It's interesting. Congestive heart failure is where your heart doesn't work very well.
I know.
And then the fluid accumulates in the lungs. And then it leaks out, and then, that causes a cough, and
Right.
then you are congested, you're not oxygenating well. So it's a death spiral. So you need to get that extra fluid out of your body with diuretics. Now, if the lung is just congested from infection, then that steam from the shower or from a steam machine does very good.
There are steam machines?
Then, yeah, you can buy it. Just, or even I tell my patients the best steam machine is just have a bowl of water boiling and put a towel over your head,
Huh.
and you got steam inhalation.
Right. I can't do that with my dog.
Warms up your tract,
Yes.
and you feel better.
Good
But
idea.
that's for the infection side and the virus infection, bacterial infection sometimes, the bronchitis and so on. So your tubes feel much warmer, much more relieved.
Yes.
But congestive heart failure is basically treated with diuretics and other medications.
Yes, he's on a lot of medications. But the interesting thing is, because I've had dogs before, he has a lot of spunk. He does everything he's supposed to. He eliminates all the things. He eats beautifully. So, I'm just giving him lots of love and all the medication, and I think he's going to be okay. I mean, as long as he can be.
I'm very happy that you have a dog, because those people who have a dog live a few years longer.
Ha!
Dogs have the propensity of giving you unconditional love.
Yes.
And number two, they make you more agile. They make you walk. You
Yes.
take them out for a walk. You
Yes.
do this. All those things make our seniors or anybody walk much more than they would have otherwise walked, which is a very good thing.
Yes, absolutely. And I want to tell you something that I just learned, and I just talked about it on my last show, and I don't know if you know. Are you familiar with the blue zones?
Blue zones?
Yeah, good. Okay, oh boy, wait till when you get off the radio show, get on the computer and look at blue zones. This is where they have tracked people who are living the longest and the best all over the world. It's called the blue zones. And it highlights the various areas where that's true all over the world. And
Yes, like Okinawa, Sardinia.
Yeah,
the Hunzas,
exactly.
the
Exactly.
In California.
Yeah,
Loma
you
Linda,
got it.
yeah.
See, you know about it. You just didn't know they have a.
Yeah.
Yeah, Dr. Oz has been talking about. So I think I'm going to start doing something about it, because it's everything you've been saying, that people can live longer, but they have to understand about diet and exercise and attitude, right?
See, I'll give you an example.
Okay.
In Okinawa, people live to be 100 very easily. But the younger generation doesn't have that prospect, because these people used to walk a lot, eat fish, and they had a lot of veggies. But the younger generation is adopting American-type diet,
Huh.
and they don't have that future. But these older Okinawans are living to be 100. And same thing happens to the Sardinians. They walk a lot, they eat fish diet, Mediterranean type of diet, lots of veggies and fruits, but lots of walking, less mechanized life. And even the Tibetan Hunzas or the Willabambas in Latin America, or the old people of Loma Linda in California. So all this boils down to a simple formula, because it's not rocket science. It's activity and diet. And number 3 is the attitude.
Yep.
The attitude. How you feel about yourself and your environment and the people around you makes a big difference. Friends, family, and happiness derived from that association as human beings.
Yeah, you're so right. I said this before to you. We have to clone you. We just have to clone you, because you are so superb. And I mean, every time that's why I want you on a lot. I always love talking to you, because you say everything that I believe and that I've read, and it's really why I became a gerontologist. I really believe that we could help people. And that's why I wrote the book, Live to Be 100 Plus. I believe that all the things that you've said do make life possible and fun. It isn't just somebody says, I
Yes.
don't want to live to be 100 unless I'm in
No.
good shape. Well,
Yes.
yeah, but get in good shape.
That's the question. Get in good shape so that if you ever reach that, if you are granted life, because we don't know how long who will live, but if you are granted that life, at least you're not in a nursing home. You're vibrant and alive and enjoying life.
You're right. And have you passed this on to your children?
I passed it also to all my doctors. You see, we train our doctors, and all our doctors are really very tuned to this philosophy. That's why they enjoy practicing geriatrics, because it's a niche where you can make a very big difference.
Yes.
Because the seniors need that tender, loving care. But besides that, they need to be motivated to take charge of their own health, because ultimately, the best doctor one has is himself or herself.
Yeah, that's true.
Nobody knows your body better than you do.
That's
and
true.
we have to take charge. And if you can make our patients take charge of their body, become responsible of what they are putting in their mouth, what they are doing with their body, and what they are doing with their ailments, makes a big difference in the long run.
It does. Are you going? So you said you're leaving. You're leaving tomorrow or next day. You're not going to be there tomorrow.
Tomorrow, no. I've got some meetings in.
Okay.
Yeah.
You know, the one thing I haven't done, I always get the flu shot. I haven't gotten the pneumonia shot, but I was told by my pulmonologist friend, make sure you get the one that's special and you don't have to get it again. Do you carry that one?
Yeah. See, before the doctor's offices used to carry shots. But now what insurance companies have done is that just contracted with CVS or Walgreens or Walmart or whatever, and they go and get their shots there, you see. Before, they would send the shots to the doctor's offices, and doctors would give them. Or sometimes they make the doctors buy the shots, give them, and then bill. It's a big rigmarole. So they've made a shortcut. So that's why you just walk into any Walgreens or show your Medicare card and you just get your shot.
Well, you may think I'm strange, but I only want to get my flu shots and my shots at a doctor's office. I do not want to go and do it that other way. Isn't that funny? I believe in doctors.
I don't blame you, but that reluctance is not justified, because they have people there who are qualified to give shots, and giving shots is not a big deal, really. As long as they do the sterile technique, which they do. So whoever gives you, even in a doctor's office, it's not a nurse also. It's usually a medical assistant who gives you a shot. So it's not a bad thing to get a shot in one of these pharmacies.
Yeah, well, but I also want a special shot, and they told me that maybe I have to find out if my insurance company is going to cover it. It will. I have United American,
yes,
and they will cover it.
Yes.
And
Yes, they will cover it. Yes.
Yeah, because I don't think that the pharmacies carry the one I'm talking about.
Oh, they all do.
The other special one they do?
Yes.
Oh, you have to ask for it, I guess, though. Why are there two? Why don't they just do the one?
Well, you see, the bacteria, we are learning more and more about the bacteria which are going to cause you pneumonia, and finding out how to overcome them, forming antibodies against them, or killing them and then putting you in your body as a dead form, so your body recognizes it. So if you really get the infection, your body says, aha, I know these bacteria. I know how to kill them. Because, infection is fought in your body with antibodies and your white cells, which are the soldiers. But the body has to recognize any foreign protein as an enemy. If it doesn't recognize it, then that protein, which is from the bacteria or the virus, is causing a lot of damage. Then your body says, aha, these guys are bad. Let's make antibodies.
You're good.
That's the problem with a common cold. You see, cold, you've got a virus infection.
Yeah.
And your body doesn't know them. So it causes a havoc, and you're miserable for 2-3 days. And the body says, hey, these guys are not good fellows. Let's do something about it. So it starts making antibodies. So by day 3, 4, 5, you got antibodies, and then your cold is gone. See? And the reason why we can't find a vaccine, because this virus is mutating all the time. So the cold virus you got last year is different from the one this year. You see, they're always changing. So
Right.
also the bacteria get stronger, and the newer bacteria start doing bad things. So we find those guys and make a new vaccine with those bacteria's protein in that shot.
Well,
so that's why there's always evolution in the vaccine technology. As we go along, we learn more and we make better and better vaccines.
so talking about that, I was with a group of people who are into research, the Scripps research and other people like that. And it's not that they're curing cancer, but what they're able to do now is to have enough research for specific cancers that seem to work. So they don't say that we're curing cancer, but we're able to take care of particular cancers. And I know you know about that.
Yes, it's a very good example would be President Carter. President Carter had malignant melanoma, which is one of the most virulent cancers you can get. And it's almost a death sentence. But they gave him the immune therapy where they trained his own cells to understand the cancer and go and fight them and inject them back into his blood. And they went and fought the tumor, and he's free of the tumor. He got some side effects, but he's still alive. And I think last year he did some Habitat for Humanity, and he's 95 and he's still alive.
Oh,
So
that's a
miracle.
fabulous story.
Yes.
So
we
it's
have done well.
immunotherapy. I hear so much about that, but you believe in that. It's really the answer to a lot of things, isn't it?
That's the future. That's the future of cancer treatment. You see, just now we have treatment that is like a cannon for a small problem. It blasts everybody, the good cells, the bad cells. You kill the green grass and the dried grass, all of it, everything dies. That's a regular chemotherapy. But now immune therapy will just go and kill the bad cells. That's it. Not the normal healthy cells.
Fantastic.
And that would be the future. If you had an immune therapy for every cancer out there,
Right.
it'd be good. Now, a lot of people would say, why do you get cancer in the first place?
Okay, that's a good question.
The truth is that our bodies are multiplying their cells. We are replacing our cells. In fact, your skin, the entire skin of your body, which is the largest organ in your body, is replaced in 1 month. Your blood, your entire blood system is replaced in 90 days. Your bones are remodeled in 2 years. In 4 or 5 years, you're a whole new person.
Huh.
The cells that you had 5 years ago are no longer here. You're a new person, literally.
Amazing.
So that's why you could live forever.
Right. Well,
but we do age, okay?
Yes.
So the aging process happens because the DNA gets modified, the telomeres get bad.
Yes.
It's getting a little complicated, but the thing is that it's like a photocopy of a photocopy of a photocopy as cells are produced. So it gets grungy, and the DNA information is not so good. So you got an older looking cell. So your skin that was baby soft when you were a baby now is crinkly and with lots of marks. You see?
Right. So we don't want to get grungy.
But these cells are new. Yes, exactly. But the cells are new.
Huh.
But what happens to those cells that were modified but started doing bad things?
Huh.
Your immune system immediately recognizes them and kills them. Then every day, you and me are forming cancer cells in our body. Every day. Cancer cells are normal cells from any organ that are just wayward. They're not functioning right. So they don't belong. They should be removed. But for multiple reasons, all of them we don't know, some cells continues. Like, you could have a colon cancer or breast cancer. Those cells start multiplying. And this is the whole problem about cancer today. So one of the things that will reduce your cancer chances if you sleep 7 to 9 hours a day. Give your body a chance to repair your body. That's when the repair happens, when you're sleeping.
Wow.
Because when you're awake, you're busy doing all those things that you do, and your body requires full attention. But when you're asleep, then your immune system, your blood system, everybody has the time to concentrate on cleaning up the bad cells, cleaning up all those toxins, and get you cleaned up for the next day.
Oh, I just love what you've said.
And also, our diets help us fight cancer. When you take a lot of plant proteins, the phytochemicals, the antioxidants that come from our fruits and veggies, they combat all these things that really are negative for your body.
Amazing.
That's why diet is so important. What we eat is what we become. And perhaps also a great help in fighting cancer.
Well, I know you never write articles. You're very busy, and I know you're wonderful. You come on the show and all, but is there any chance that I can get an article from you?
Yes, I'd be glad to do that.
Okay, but you can't do it until February.
Just let me know, and I'll work on it.
Work on it with all the kinds of things that you talk about. And I'm going to call your son and make a date with him and see if I can get everything straightened out with him too. So I am going to do that.
Okay.
I'm going and I do appreciate your taking the time. I hope that you have a wonderful trip and be safe. And
thank you.
Yeah, and send me something.
Okay. It'd be my pleasure to do so.
All right, and let me tell everybody you've been listening to MOSHIN JAFFER, and he, of course, is the founder of Senior Medical Associates, and you can get on their website, which is seniormedicalassociates.net. You will be so happy if you do it. Trust me. It's the best medical practice that I know of here in South Florida.
Thank you.
Thank you so much, Dr. Jaffer. Goodbye.
Goodbye.